Hi, everybody. My name is Michael King, and I have the pleasure of being joined by Drs. Joseph King and Dr. Andy Kopstein from King LASIK and K2 Vision RLE. We are serving the Phoenix area with our brand new Scottsdale location, and also the Pacific Northwest with areas of Seattle and Portland, as well as Eastern Washington. So the question, gentlemen, that I have for you today is one that I'm sure a lot of our patients have, which is, what is the difference between LASIK and RLE? So Dr. Kopstein, I'll give you the first answer to answer that question, please.
LASIK is a procedure where we're changing the shape of the cornea, which is the first structure that light passes through on the way to the macula in the back of the eye. Refractive lens exchange is a procedure where we are changing the lens inside the eye, which is the second clear structure that light passes through on the way to the macula.
Dr. King?
LASIK is a great way to correct nearsightedness, farsightedness, and astigmatism in people who are 18 to 45 years of age. We're changing the shape of the cornea, which changes the way light is bent as it passes through the cornea. Beyond age 45, the lens begins to lose its effectiveness in changing the focus from distance to near, so most people begin to develop a need for reading glasses. And for that reason, we begin to consider a refractive lens exchange as people get older, especially as they begin to develop a cataract, as that lens starts to yellow. So by the time most people are in their 50s, that lens is not functioning. That's known as a dysfunctional lens. They're no longer able to see both at distance and near clearly. So a refractive lens exchange could be a great option, especially for those people over 50 or 55 years of age.
Dr. Kopstein, after somebody has RLE, can they still develop a cataract?
Once the lens is removed, then there's no way that that lens will become a cataract. It's replaced with a clear intraocular lens implant that is responsible for focusing the light onto the macula.
One of the benefits that we have at King LASIK and K2 Vision RLE is we have a vision solution for every stage of life. So Dr. King, from a patient's perspective, what is unique about our approach to vision?
Well, I've been performing LASIK for well over 20 years now, and I have seen over the years some patients who may not be the very best candidates for LASIK. As they start to get older and they're beginning to develop perhaps an early cataract, they may be a better candidate for a lens-based procedure. At the same time, there are patients who may have certain prescriptions, particularly farsighted patients who are older than age 45, who want to be able to see simultaneously at distance and near. And some of these patients could be treated with LASIK, but it's not the best long-term solution. So Dr. Kopstein and I have come together with K2 Vision and King LASIK to provide the best solution for each patient at every stage of life.
That's right, Joe. What we're trying to do is create a unique, customized approach to each patient, depending on what stage of life they're at. If you're younger, generally we're going to be doing LASIK. If you're older, on your way to a cataract, if you've heard that you're starting to develop a little cataract, that would then lean us towards more of a lens-based solution.
If you would like to find out if you are an ideal candidate for either LASIK or for RLE, we would love to have you to schedule a free virtual consultation where we can have a moment to connect with you, answer any questions that you may have, and then be able to guide you down the right path to help you get the visual outcome that you're looking for. So we look forward to seeing you on one of our virtual consultations and hopefully in our practice sometime soon. Thank you very much, everybody.